I am Dr. Joyce Wamishe from the Digital Health Agency, and together with me is part of the team, the product development team, represented by Jared Onsomu and Marvin Gondi. And it's like you were with us when we were developing this demonstration. So TaifaCare is what we are rolling out, and it's a user-centric solution that is integrated to the digital health superhighway. We have been at this facility for the last couple of days, training the staff. They are really enthusiastic about it, and we've also been configuring it to be able to see both military personnel and civilians who are SHA eligible. So the plan is to have this system deployed to all the military health facilities countrywide, and we are looking forward to this particular facility being the model facility that goes paperless. As you've alluded to, this is the home page, but you have rightly described the identification process. So we ask for the national ID, and I'm describing for the civilian that are SHA eligible. We ask for their ID, and we are definitely making sure that we are not dealing with a ghost. We are dealing with the true person that we want to serve. We also can see that they are SHA eligible. Exactly. And then after that, they have registered and done, they're eligible, they can get services under SHA. After that, we queue them to the triage. And then at triage, this particular system has got clinical support alerts. For our patient today is Marvin, a 32-year-old male, and we can already see once we put he has fever, so the system is even saying this person is febrile. We are also able to see that this is a person who needs to be fast-tracked in terms of triage compared to somebody who's a bit more stable. Then we take them to the consultation room, where we can see this. We had pre-filled this, but we can see that we can see the patient physically, and we can, today we put in some more information at about 5:50 a.m. And here the clinician is able to take care of the patient, do a very good, and then do any lab radiology. The history, so the patient will give us the history. The past histories, they're already in the system. And then when they come, exactly. That exercise book imepotea. Hakuna makaratasi. Exactly. Yes, exactly. Inararuka. Exactly. Yes. Yes. Exactly. What medicine they've been given. Yes. What treatment they've gone through. So you have the benefit of that history. Yes. Right at this. Exactly. You're very right, sir. We actually say we want some. Oh. Yes, we want someone to give their history once, and then after that, it's just building. Exactly. So for today, it's a short patient journey. We then prescribe some medication, and then the patient goes to the pharmacy without any paper, no prescription, and finds the pharmacy. The pharmacy view is like this, and the pharmacy is able to dispense. Now, Your Excellency, after that, the patient goes for discharge from the patient journey to billing, where another OTP is done to say now the patient journey is complete, and then the bills have been accumulating as the patient moves from one service delivery point to another. So at the billing, the patient is discharged from the patient journey, and then the various bills are put together. There is some verification before we move it to the SHA for processing. One of the hallmarks, Your Excellency, for this system is tunasema data mkononi. So this is a dashboard for the facility. So the leadership will definitely appreciate this kind of dashboard, because the CMO will be able to know how many patients have come over today and over the past 7 days, and we can even configure over quarter, over the last 1 year. We'll be able to know our patients who are coming, what are they sick from, Here, what's the disease? Yes, exactly. So the bigger the writing, the more common it is in this facility. And we can even do this for surveillance. So remember the time we had COVID. COVID most likely came even before that March. We would pick it with this system earlier. When it comes to collections, we have, as I said, we have configured to be able to see military, but now we also have SHA, and we can be able to see the collections via whatever scheme that the facility is having.
their helps. They was told to plan ahead what kind of medicines.
Exactly. Exactly. Spot on, Your Excellency. Here is the pharmacy place where you can even see how many of those prescription orders have been fulfilled. So you're able even to know which are these medicines that are not being fulfilled, and we need to get them in this particular place. So with that, Your Excellency, we definitely feel your leadership. We really, really appreciate, and that's the end of this small demo. And we look forward to this facility being paperless and guiding the way for the other military health facilities. Thank you very much.
I'm very happy with this.
Thank you.
This
Thank
is
you,
what
sir.
I want.
Thank you, sir.
And it's going to happen.
It will
This
definitely
will happen.
Yes.
Yeah. Makelele aside, this will happen. Okay, thank you very much.
Thank you so much.
I'm sure the people who have been handling papers, I'm not hearing them too.
Well,
The people who have been handling around these papers,
we are more than excited. We have trained every member of staff.
Yes.
We have brought out the system.
Yes.
And we are happy that we don't even have to lose prescriptions today. Whenever whoever gets medications from this facility only gets that which has been from the system. Yes. There are no side routes. No side manenos here. We are more than happy, Your Excellency.
Place to place,
The beauty of the system also is that you have visibility of this across the regional hospitals, so that a patient senior, the file is available in the other regional hospital. Yes, sir.
Dr. Ruto is from the Ministry of Health. She started her journey in our hospital.
Okay.
She's our intern.
Okay. Okay. Very good. Very good. I was talking to your team, the DHA team, last night. Just trying to tell them how to configure so that we can